seeing images of the devastation from the wildfires, even from afar, can certainly trigger anxiety. But the stress of experiencing that firsthand can last years if you don't face it head on. With the danger and destruction wildfires can bring, it's easy to understand the stress people experiencing them are under.
A disaster like this can have huge mental health impacts. There can be signs of anxiety, depression, and post-traumatic stress disorder.
Up to 40% of impacted communities can show signs of these clinical symptoms, says Dr. Mishra, including anger, shock, sadness. There's the uncertainty of losing a home, a neighborhood, a neighbor. The stress can bring cognitive impacts too, making it hard to focus when everything around you feels threatening.
People will feel very distracted, unable to pay attention to their daily life activities, and they will also have poor ability to make decisions.
Both victims of a disaster and first responders are vulnerable.
Firefighters are all under the threat of PTSD as well in a situation such as this. They have received some amount of resiliency training, but they're not immune to these mental health impacts.
The mental health impacts can linger years after the smoke clears if they aren't addressed, says Mishra. Talking with a trained professional can be key. Other coping mechanisms like listening to music to de-stress and deep breathing exercises can help, along with volunteering and talking with others going through the same thing.
This is collective trauma, which requires a collective healing and us supporting each other.
And Mishra says when having those conversations with others, try to be mindful to not have it all be doom and gloom. Instead, if you can, switch to a survive and thrive mentality. In Washington, Brian Abel reporting.